Coming up today, a young father and husband thought maybe he could power through some stomach pain. Why he's glad he took his wife's advice and finally saw a doctor. Good morning. It's Friday. I'm Jessica Lovell. Welcome to the Morning Medical Update. Today, we are hearing from a man who fits an unfortunate trend. More and more young adults getting colorectal cancer. We've shown you these 20-year graphs from the American Cancer Society before. For people ages 65 and older, colorectal cancer rates are dropping. But for adults ages 20 to 49, those rates are slowly going up. And today we are joined by Alex Treaster, who was just 37 years old when he learned he had cancer. So thank you, Alex, for being here with us and sharing your story.
Thank you.
We are also joined by Dr. Ben Martin. He is a colon and rectal surgeon who met with Alex before referring him to his oncologist, who we hope is going to join us here remotely in just a moment. He's busy in clinic with other patients, so we'll stand by for that and introduce him in a moment. But Alex, you're a professor at KU School of Journalism and Mass Communication, so nice to have you here with us. We'll learn a thing or two from you perhaps today. You're also, though, most importantly, a husband and a dad. You've got a 2-year-old boy at home?
Yes.
Oh, good. Yep. Okay, so we're going to see some photos of your wife and son here in just a bit. But you get the news that you have cancer. Was that even on your radar? You're young, you're working, you've got life ahead of you. How are you processing this news?
Yeah. I mean, honestly, it was a lot to handle. It's a big shock to receive that kind of news, especially at such a young age. So personally, I have a lot of familiarity with cancer because my father passed away from melanoma when I was 16. And then I also had a stepfather who passed away from skin cancer as well. So cancer in general was definitely on the radar, something I had a lot of firsthand experience kind of being around, but it was still, both of them were older, and so it was something that I never expected to experience as a 37-year-old.
And were you diligent about, just because it's that time of year, melanoma, very scary, were you really diligent about protecting yourself and making sure that you're getting all your checks and your screenings?
Yes. I have always been, very religious about being there every year to get the skin checks and applying sunscreen and doing all the right things with that, but I didn't have the colon cancer on the radar as much.
Right. Well, you're 37 and you're not supposed to get those colonoscopies, right, Doc, till you're 45. So why would anyone think that? So let's talk about those first signs and symptoms that you had that made you think maybe something's wrong.
Yeah. Well, so last fall, I actually had started teaching full-time at KU, got the job last August. So it was my first semester full-time, and I had done some teaching before, but it was like, wow, I finally got my dream job. I'm so excited to be here. And things were just going really well in multiple areas of life. And so it was, tempting to just kind of want to dismiss whatever symptoms, and because they're, a 2-year-old son to take care of, and just a lot going on that I wanted to make sure was taken care of and that I was staying on top of. The first symptoms were really some stomach pain just kind of popped up, and I thought, maybe I ate something wrong, or maybe it's stomach bug or something. And things really moved pretty quickly to where within a couple of days, the pain had advanced to a level where it was like almost bend over, like you can barely walk at times when it would hit me. So
were you having GI issues? I mean, just let us have it. What was going on down there?
Yeah, definitely. When that pain arrived, it was accompanied by more just GI issues in general, like constipation, but also diarrhea at times, and so that was I was definitely noticing that. And then within a few days, really, it was within a week to where those symptoms really advanced to then having blood in the stool and that kind of thing.
Okay, so we mentioned that your wife encouraged you to get things checked out.
Yes.
What was her encouragement like at home? What was she saying to you?
Yeah, so I was definitely, like I said, like tempted to just kind of power through or try to. I just wanted to think like, oh yeah, this is just a temporary thing. It's going to go away. And she was really good about, after 3 days, she's like, this isn't going away. I think you should at least go get this checked out. And so I'm really glad that I followed her advice.
Yeah, you think?
Yeah.
Listen to the women in your life.
That's
okay,
right.
so how fast then did things move? Did you two meet right away? Just talk to me a little bit about the process. You walked through the doors and then what?
Yeah, so the process was I ended up going to the emergency room originally. Elsewhere, yeah. And they did a CT scan, saw that there was some thickening of the colon lining, and so then they determined you need to have a colonoscopy here right away. So we got one scheduled like for 2 days later. Did all the prep work, and that did not go well because the tumor was there. And so then ended up going back to the hospital because I was in pretty bad shape at that point.
And you bring up the prep because we always talk about colonoscopy prep, not fun. It's worse than the colonoscopy itself, which is actually a breeze. But you said it was actually even more difficult because of that tumor. Dr. Martin, were you aware of that? Because we don't think about that because we think of colonoscopies to be preventative, a screening tool versus going and getting it and finding out you do have a tumor.
Yeah, I mean, I think the bowel preparations are always difficult, you know, so, but if you have a partial blockage or something like that, then a lot of nausea, bloating, you know, it's even more, you know, alarming when patients come in that situation. And so, you know, if there is that partial blockage, you know, it's a little sign that things are more advanced potentially.
Yeah. So part of all of this, though, Alex, is that you had to have part of your colon removed. You had that done elsewhere.
Correct.
What was that process like before you ultimately came here to us?
Yeah, so from the onset of symptoms until the surgery, it was exactly a week. It was one Saturday to the next, and they were wanting to move very quickly with it, which I'm glad they did. So they were able to do a colonoscopy, found, of course, that the tumor was there, and then said, all right, let's get in and get this surgery done. Thankfully, that went really well, had a good outcome on that, but where Dr. Martin comes in, so actually, Dr. Martin's brother-in-law, Jay, is one of my best friends, and we've been friends since first grade. So long friendship. I had known Dr. Martin for many years, just kind of socially as a family friend, and when I was in the midst of this process of preparing for surgery and then the recovery afterwards. He was just readily available, so great about being there to answer questions, and it was such a great resource to be able, like, I remember being in the hospital bed and having questions about things or not understanding certain terminology and being able to just text him or call him and get some really clear explanation for what was going on.
It was a good time to have a bestie, a long-term bestie who has a doctor in the family,
no
right?
kidding.
And so you two became fast friends, I know, and that really helps with this process. Dr. Martin, what's it like, as we talked about some of those stats and having, it's easy, it's hard to tell a young patient what they're facing. What's that like telling a 37-year-old young man just got the job of his dreams that he's now facing colon cancer?
Yeah, I mean, I think initially you just kind of acknowledge that this sucks, this is a difficult situation, not to sugarcoat it. And then kind of, gather information and try to distill it down to non-medical jargon. And then, really successful people like Alex are planners, right? They want to know, like, so what can I expect? Like, how is this going to affect my job, my family, those sorts of things. So kind of just walking through what I would anticipate the steps are going to be so that he can plan and stuff like that. And just reassuring him that, I think the plan that's laid out for you is a good plan. I mean, and then kind of also, if you need additional resources or kind of getting you to the right person, ultimately, which, is Dr. Al-Rajabi.
We're going to bring him here in just a moment. But why he had part of his colon removed. Was he sent here to the cancer center because he needed a higher level of care? Why the movement over to us?
Well, yeah, I mean, I think, colon cancer operations are very commonly performed by general surgeons just because there's such a high volume. I mean, it's one of the most common cancers, and so there are quality indicators, that we look for. And so we kind of double check to make sure a certain amount of lymph nodes, the margins, things like that. And so, the surgery looked good. And then at that point, there's an indication for having kind of the adjuvant chemotherapy or the chemo after surgery. And so that's where, I felt like, Alex would be better served here at KU, and also screen for trials and things like that as well. And so that's why I at least, offered that for him.
Yeah, access to all types of different treatments that are curtailed right to where he needs it. So then he hooks up with Dr. Al-Rajabi, who is joining us now. How are you? Good morning. All right, I think you're muted. Can you hear us okay?
Sorry, I was on mute. Thank you for having me. I was a little late. We're still in clinic today.
That's okay. We'll take you any way we can get you. Thank you. All right, so Alex, what was it like when you first met Dr. Al-Rajabi? What was that process like?
Yeah, so again, thankful to Dr. Martin for getting me connected with Dr. Al-Rajabi. And Dr. Martin said, I think you'll be in really good hands. He'll take great care of you. So that was reassuring. And then the first meeting with Dr. Al-Rajabi was, at that point, there was still a lot of unknowns, a lot of uncertainty about the situation. But one thing that I really appreciated about Dr. Al-Rajabi was how good he was about answering questions, even the really hard questions. And so when I would ask him, what are we dealing with here, he just did a great job of clearly explaining to me the situation and the plan going forward. And so it was very reassuring to have a doctor who was willing to be honest and direct with you, but obviously still cared an immense amount.
Absolutely. Yeah. Alex, I know you needed 12 rounds of chemo, correct?
That's correct. Yeah.
Dr. Al-Rajabi, what went into his treatment plan? How were you going to attack this alongside him?
So a lot of times we kind of calculate the risk of recurrence depending on what we find on the under the microscope. And Alex did have some disease in some of the lymph nodes, and that indicates that his cancer could potentially have tried to spread outside of the area. So we generally recommend chemotherapy, and there's different forms, but pretty similar side effects of two different forms of chemotherapy. One is called Folfox and the other is Zelox. These are acronyms. But we went over the side effects of the chemotherapy. We also talked about Alex's job and how his life is going to be with chemotherapy. That was very important to figure out which approach would be the best to keep him on track doing what he loves, with hopefully minimal toxicities with the maximum benefit. And after discussing that, figuring out what his goals were, I think it became clear that 12 rounds of chemotherapy with Folfox was the way to go.
Dr. Al-Rajabi, I have to ask you, because we were talking about the stats off the top of the program, and watching this rising number in younger people being diagnosed with colorectal cancer. What do you make of this?
We really don't know. Fortunately, colon cancer in the populations that we're used to, the above the age of 50, has been actually going down because these populations are routinely screened with, either stool studies now or, colonoscopies. And once we find the cancers in an early stage, their outcomes are very, very good. Now, we don't know why, but patients that are young that are just having a really, really large rise in incidence of colon cancer and rectal cancer. And by 2030, we're going to see about 150% increase in this population. And this is the population that doesn't really routinely get screened. And people, sometimes just don't know what's going on, or they don't advocate with abnormal symptoms to really get checked.
Dr. Martin, how do we fix this? How do we make sure that the word's getting out? You're a young guy too. And I mean, how are you talking to peers? Do you have this conversation with friends and telling them to get their colonoscopies when they hit that 45 mark?
Yeah, I do. I mean, certainly when young patients come in, if there are people with them, spread the word. And, I think, talking to the primary care doctors and stuff like that too, just have a very low threshold to do a colonoscopy in younger patients these days. Rectal bleeding, I mean, people commonly attribute it to hemorrhoids. But if it doesn't respond the way you think it should, colonoscopy,
right.
Very quick. And so I think just having that low threshold and being quick to do some sort of screening test.
And it's not the most comfortable thing to talk about. Let's just be really honest. right?
Right.
I mean,
Yeah,
it's not
yeah.
like something wrong with your arm.
I mean, you're in your in your 30s. You still feel kind of bulletproof,
Yeah.
and that's like Alex said, that's not on your radar. So doing stuff like this, other outreach things we have to try to raise awareness.
And I want to talk about that. Alex, Man Up to Cancer is a group you're a part of. Let's talk about this.
Yeah. Phenomenal group. So I originally found them on Facebook. I had read some things online about what a great group this was. Started by a cancer survivor who also the group is for all men and caretakers as well who are dealing with cancer. But interestingly enough, like a very large percentage of the members of the group are colorectal cancer patients.
What do you hear from them? What's out in the community? What's the talk like on these social media groups?
Yeah, a lot of talk about what we were just saying about the rising trends with younger people getting colon cancer. So it's a national group, but we also have a local chapter of guys from the area, and so we actually do in-person meetups too, and that's fantastic because it's like these people get what you've been through. They understand, how difficult it is, but it's like we speak a common language when we get together, and so that's really helpful. But I would say out of the group that we met up with last time, every single guy there was under the age of 50, and almost all of them were colorectal cancer patients.
It's not a club necessarily you want to be a part of,
No.
but you're glad you're not in it alone.
Absolutely.
And you said that the silver lining, if you will, of all of this is just having your own circle of friends that you came to the table with, kind of your bros who really showed up with you in a big way. Tell us about that. Here they are, kind of your team, your squad. They were with you all the time.
Absolutely, yeah. So that for sure that was a silver lining. I mean, you learn a lot about the people around you when you go through something like this, and you just see so much of the good side of people come out. So it was just across the board in terms of like the support that they gave me and my family. There was one time early on where it was the fall season, so there were a lot of leaves on the ground. So those guys came over to our house, got the whole lawn crew going.
Love it.
They did such quality and efficient work that other neighbors were coming over saying, "Hey, who's your lawn service? Can we hire these guys because they're so good?"
They're hired.
Yeah, I'm
They're
like,
hired.
yeah. The only cost is 30 years of friendship. So
Exactly. Well deserved for sure. So, and you went through these 12 rounds. Are you done with your chemo?
Yes.
And they were part of that too. They came in and hung with you and sat with you.
Absolutely.
I think that's really what attracted me to your story. The
Yeah.
minute you said, I had these friends come and show up and sit with me in that chair you're sitting in, and it's, again, no chair you want to be sitting in, but feeling that love. And Dr. Martin, you know how important it is to have support from family. It's one thing to have doctor support, but you got to have family support to get through this.
Oh yeah,
right?
and Alex has great support with great friends. I mean, I recognize a lot of those people in those pictures, and so yeah, not everybody's so fortunate. It can be really difficult, and so yeah, he's really lucky in that regard.
And I'll just say too to build off of that, like it's. I see these guys frequently. We get together with our families, which is awesome, but it's the older we get and the busier we get, the more rare it is to like have one-on-one time with your guy friends.
Yeah.
And so they would come and sit with me, and those were some of the most like profound conversations where we'd like get into talking about deep life stuff that you would otherwise maybe never get a chance to talk about.
And you two, when you two walked in today, I said, "Are you two related? You look like brothers." You look like brothers. And so I have a feeling maybe you guys have just kind of morphed into this friendship, right? Right?
Yeah.
It's just the way it works.
Yeah. I mean, we are kind of like brothers separated like twice probably here. Yeah. Through family.
Friends for life now, for sure. Dr. Al-Rajabi, what's the follow-up? What's the follow-up you're going to have with Alex, in the next coming months and years to come?
So the follow-up basically, includes blood tests and scans, of course. We also need to follow up on Alex's colonoscopies. He's going to probably need an earlier colonoscopy because he was pretty blocked up at the beginning. But we also consider things like circulating tumor DNA. That's basically DNA that was produced by the cancer that we removed, and we check in the blood regularly to see if any of that is starting to come back. Fortunately, everything is all clear, and it's just a precaution. We kind of monitor Alex going forward. After Alex was diagnosed, and we are starting to develop more technologies to improve odds, like developing cancer vaccines in patients that still have problems with their cancer, or they didn't clear their disease completely. So there's a lot of options on the horizon for more aggressive cancers. But fortunately, we're doing really well at this point.
Dr. Al-Rajabi, any reason someone should get a colonoscopy younger than 45?
Absolutely, if you have family history. So, Alex and I talked about this. He's raised the risk of his offspring significantly of developing cancer, and they will have to be scoped 10 years before he was diagnosed. So they can't wait until they're 45. Now, Alex was tested for anything that could be inherited that could cause his cancer, and we usually routinely do that every 5 years if we don't find something. So right now we're not detecting anything, but in the next 5 years, you never know. There may be other genes that we discover that potentially could be given or inherited, and that would need to be addressed.
Be sure to ask your questions. You can use the chat on YouTube, Facebook. You can tweet us or email the Medical News Network. That info is right there on your screen. Let's get to our COVID count. Dr. Dana Hawkinson has the morning off today, so I'm going to jump right in. Today we have 19 overall inpatients, 8 active infections, 1 in the ICU, 1 on the ventilator. So creeped up just a little bit. We'll see how we do when we come out of the holiday weekend. Do we have any reporter questions? We do not. So let's get to some great community questions from our viewers. Nathan wants to know, can you do anything to prevent colon cancer, like changing your diet? Dr. Martin, what are your suggestions?
Yeah, some of the theories of why early onset colorectal cancer is happening is related to obesity, sedentary state, some of the high fructose corn syrup potentially. These are all theories, so I think, having a good high fiber diet, well-balanced diet, kind of lower on the red meat side probably, those dietary things, and then just being active, avoiding obesity and stuff like that are probably the best things you can do to prevent.
Alex, what changes have you made in lifestyle, diet?
Yeah, a lot of changes from like the exercise, physical fitness front. I've always been pretty active as a runner, so just continuing some of those things. Diet-wise, it's a lot of what Dr. Martin just mentioned. So really, I've cut back on red meat consumption, like to very minimal. Trying to just eat a lot more kind of healthy fruits and vegetables and less processed foods for sure. That's a big thing.
We hear that a lot, but when we have someone sitting here who's gone through it, it just is a good reminder how much what we do, what we put into our body is what we get out of it. So just a good reminder.
Yeah, and Alex really doesn't have any of those risk factors, so that's
right.
just a reminder that it can still happen. So that's an active area of investigation currently.
Yeah, but it's something we can do to put health in our own hands. Dr. Al-Rajabi, are the at-home stool tests useful and effective?
Yes, I think they're very effective. They could definitely diagnose. We're seeing more and more patients being diagnosed that way. But the gold standard is a colonoscopy. So if they are positive, you still have to get a colonoscopy. It doesn't make the diagnosis. There are other tests that are being developed at institutions like KU, and blood tests are actually starting to emerge in our research in a lot of colorectal communities. So more to come on that. But yes, they've been very effective in the screening. But I think even if they're negative, you still really need to talk to your primary care physician whether colonoscopy is right for you.
Dr. Al-Rajabi, viewers are just really interested in what's driving these numbers. So we've touched on it a bit, but let's go back over it. Jeremy wants to know, we know there's a lot of mystery in what's driving those numbers, but is there anything that we do know that are the contributing factors, lifestyle choices, anything that we can do to even just move the needle a bit?
It's really it's mind-boggling. We don't know. I think a lot of this if you look at our obesity epidemic, just like Dr. Martin mentioned, it's been rising in the United States, and you could see a similar rise with our colon cancer diagnoses. Whether that's because of the food we're eating, you really don't know which came first. But I think, just like Dr. Martin said, I think the key for us all is to go back to really healthy diet, try to decrease the processed food, because we'll probably discover this in the future, but it's really, really hard to know what's really driving this.
Mark says that he had polyps removed during a colonoscopy. They came back normal, but since he had a polyp, does that automatically mean he's at a higher risk of possibly developing cancer down the road?
Not necessarily. Not all polyps are concerning. It depends on the size of the polyp and the pathologic makeup of the polyp. So some polyps are very benign, and some of them can be potentially pre-malignant. The pre-malignant ones, we usually tend to either consider a colonoscopy in 1 to 3 years, but the benign ones, you could just stay on your regular schedule unless something changes.
A couple more questions. Danny wants to know, you had mentioned that colorectal cancer is hereditary and that Alex's offspring will need to be checked earlier than 45, but did the fact that Alex's dad had melanoma put him at a higher risk factor?
Not necessarily. There are some inherited disorders that could increase your risk with melanoma and other cancers, but colorectal is not that common. There are some familial cancers that could potentially be related with skin disorders, not necessarily melanoma itself, but not really strongly or directly related.
Alex, I have a feeling your dad would be really proud of the way that you're reaching out and handling this and getting involved and making the change. So sorry about your loss, but we appreciate you sharing that and carrying the torch to help others. Last questions from Rose. Were you still able to teach while you were going through chemo?
Yes. In fact, that was something that Dr. Al-Rajabi and I talked about in that initial appointment that we had. And I was explaining to him at the time about how this was my dream job that I'd finally gotten. And he recognized that fact and said, I think if you can, it would be a good idea to keep teaching in the midst of chemo. And really glad that we were able to make that work. And I was able to teach 3 classes this last semester, and just the opportunity to connect with students and pass along some of the information and knowledge that I have was a big thing that kept me going, in addition to being with my family.
Your student, love, I bet you felt a lot of love from the students.
Absolutely, yeah.
You're getting it from all areas. All right, Dr. Al-Rajabi, I know you need to get back to patients, so does Dr. Martin. Dr. Al-Rajabi, what's the takeaway today? What do you want folks to know?
Always be in tune with your body, and if there's something wrong and it's not getting better, keep at it and make sure it's checked out. Be your own advocate.
All right, Dr. Martin, what's the takeaway? Yeah,
I mean, that's great. I think that, if something doesn't seem right, get it checked out. I mean, no matter how old you are, right? Because especially in this younger age group, we need to be more vigilant.
Absolutely. All right, Alex, what's the takeaway from your story?
Yeah, a lot of things I could say, but information is key. So do your research, be your own advocate, and learn as much as you can about the condition that you're facing. Pay attention to your own body. And also, just in terms of getting through a journey like this, nobody gets through it alone. So reach out to your network, rely on the people around you, and lean on them, and they'll come through for you in big ways.
Even in the yard work.
Yeah, absolutely.
Picking up the leaves. Love it. Guys, thanks so much for being with us today. Have a great weekend, great long weekend. Thanks to all of our guests and our viewers for being with us. We have 2 programming notes that we want to let you know about. We will not have a show on Monday, of course, because it's Memorial Day. Enjoy your weekend. And then starting next week, we will begin what's called our summer schedule. We did this last year. We'll have live shows on Monday, Wednesday, and Friday. And then we will see you for encore presentation programs on Tuesdays and Thursdays. So again, enjoy your holiday, and we will see you next week on Wednesday with Open Mics with Dr. Stites. Ron Hoffman spent most nights struggling to breathe. Sleep apnea was messing with his memory, and he didn't even know it. I'm Jessica Lovell on the next Open Mics with Dr. Stites, the challenge of diagnosing sleep disorders and the growing range of treatment options that go way beyond a CPAP machine. Wednesday at 8 a.m.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.